It's time now to talk public health. Joining us once again live is Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, always good to see you. Now, bird flu is something that gets headlines from time to time, but you're actually monitoring the situation in the UK where asymptomatic testing has been taking place for poultry workers, and it's finding some positive cases. So how concerning is this to you?
Well, for starters, I think it's a very smart program to have. And whenever they have an outbreak, they're certainly testing any person that has come into contact with those birds, especially people who work closely with those birds on poultry farms. Now, they did find what looks like a positive case. The other case might not be a real positive, but that's really important because then you can do the contact tracing and make sure that there isn't onward human-to-human transmission. In this situation, there was no further human-to-human transmission, obviously good news. And these are programs that you really need to monitor the situation. And of course, if there is onward transmission among humans, you can quell it very quickly by responding to the outbreak. So we need more programs like this, and it's good to see this rolling out of the UK.
Okay. Turning now to COVID-19, Dr. Bogosh, national vaccine advisors, NACI as well, recommending that people get a fall booster for COVID-19. Where are we in terms of COVID-19, the current status of the virus in this country? And do you think that a fall booster campaign is necessary?
Makes total sense. So currently, we're in a bit of a summer lull. Of course, COVID is still here. Of course, it's still circulating. It's just at much lower levels than what we saw earlier on in the year. We see hospitalization rates in significant decline. We see wastewater signals low in most parts of the country. That's really good news. Doesn't mean it's gone. Still here, just in lower amounts. But we know it's going to come back. This is going to wax and wane and wax and wane with time, and we'll likely have a surge in the fall and winter season. We know certain people are more vulnerable to more severe manifestations of COVID, putting them at risk of hospitalization, ICU stay, and death. We know those are typically people on the older end of the spectrum, like those over the age of 65, people in nursing homes and long-term care facilities, people with underlying medical conditions, putting them at greater risk. So there's a whole list of people that are at greater risk for severe infection. And what the National Advisory Committee on Immunization said is, we're going to be rolling out COVID boosters in the fall. It's especially important for those at greatest risk of severe infection to get that vaccine. So stay tuned. We'll probably see that roll out sometime in September, October, November, probably closer October, November. And I hope we talk about it a bit more to remind people, especially those who are at greatest risk, to get the vaccine when it comes out.
Absolutely. Dr. Bogosh, we've been kind of tracking for some time now all the new variants of Omicron and COVID-19 popping up, whether it's in the U.S. or here in Canada. I've forgotten some of the names. I know there's an XXB.1.6, something like that. Forgive me for getting my letters and names wrong. But where are we in terms of variants? The ones we've tracked, have they proven to be more dangerous at any point, or have they all kind of fizzled out?
Well, so now we're the variant du jour is really something known as XBB, and there's different forms of XBB with various letters or numbers behind it. Mainly, these are more transmissible. It's not like we've seen anything that's more virulent, that causes more severe manifestations of the virus. It's typically just a more transmissible variant that can evade some protection that we've had from prior infection or vaccination. But of course, we know some people are more vulnerable to the virus. We know the virus can have more chronic manifestations after the acute infection in some. And, obviously we don't want people to get COVID. You don't want to get sick with any infection. Of course, COVID's included on that. So we can always take steps to prevent that from happening. And of course, take steps to mitigate severity if it does happen.
Okay, good to hear that it's not more severe, just more transmissible in terms of those variants. And finally, Dr. Bogosh, this is kind of a blast from the past. We actually have a viewer question from Jerry this morning, who's writing in with a question asking, can you please advise why the RSV vaccine has been approved in the United States, but not here in Canada? Any idea when this approval will be forthcoming?
Okay, I'm not entirely sure what Jerry's referring to. There's two things happening. There's RSV vaccines that are coming through the pipeline, and we'll probably hear Health Canada opine on this shortly. And I wouldn't be surprised if they roll out in the fall or winter sometime. That's fantastic. There's also another product for RSV. It's not a vaccine. It's an antibody therapy. It's called nirsevimab. And the FDA in the United States approved this yesterday. It's already been approved in Canada in April, and it will roll out. Now, that's not a vaccine. The antibodies are basically already made. It's an injection and it's for young children. It lasts for about 4 or 5 months, and it's supposed to protect them from severe manifestations of RSV. And in the clinical trials, it reduced hospitalization from RSV by about 75%. So that's already been approved by Health Canada in April, and we'll likely see that product roll out sometime this fall or winter season as well.
Okay, so either way, one's already here and one's about to be here. Dr. Bogosh, appreciate you clarifying that for us. Always appreciate your time. Have a great day. We'll chat soon.
My pleasure. Have a good day.